Hi, Sam Wolf, obstetrician gynecologist in Panama City, Florida. You know, one of the most common complaints in pregnancy is lower back pain. In fact, it's probably the most common complaint. There are multiple reasons for this. There's changes in weight distribution where the weight is now forward and some of those muscles in the back have to compensate for that. There's also increased laxity of the joints, the actual pelvis joints. Because of that, the muscles are having to kind of work overtime. That's some of the causes for this discomfort. I spend a lot of time every day teaching my patients how to deal with this. I teach a few exercises, which I'm going to attempt to do in this short 5-minute video, that will hopefully help some of this discomfort. Now, I can't do it very well dressed like this. This is my professional attire. I'm going to change into my really cool workout gym clothes. Now that I'm in the appropriate attire, I'm going to show you 3 exercises that are going to help with your lower back pain. The first one is awesome because all you need is a chair. I recommend a strong, sturdy chair like this, not a soft, like a lazy boy type chair. You need a chair that's rigid. What's really awesome about this is you can do it in the office as you're waiting for your OB appointment. You can do it at the bank, wherever you are that has a chair. You're going to sit like this, and you're going to sit straight up like this. Now, one side's going to be tighter than the other always, but you're going to do both sides, so it doesn't matter. You're going to take your leg, you're going to put it over like this, just across. I want you to loosen that knee up. I want you to get it comfy. This should be comfortable. It should not be painful. Okay, and then we're going to sit straight up. You're going to pretend that there's kind of a string coming out of the top of your head, pulling you to the ceiling. And my point is, this doesn't do anything. You have to be uptight. You have to keep your back rigid. Now, what we're going to do as we breathe out is lean forward. You're going to pretend that little string is on a pulley system pulling you across the ceiling, and down we go. Ready? Just like that. Keeping my shoulders, keeping my back rigid. Now guess what? I feel tightness in my IT band. It's pulling my SI joint apart. That's what I want. Down I go a little more. I don't feel any pain, so I'm going to go a little more. Okay, now when you feel pain, you need to back off of that. We're aiming for tightness here. You want it to be tight. You want to feel the stretch. You should feel it all the way into your SI joint and your hip. When you find that spot, you kind of sit there and just breathe for a few minutes. Okay, now we're going to switch sides. Do the same thing on both sides. Up straight, down we go. People may look funny at you in the lobby, but that's okay. We're trying to address this discomfort. Down we go. After you've done this a couple of times for a few minutes, stand up. You're going to feel good. You'll feel that blood flow through there. So, on to the next one. All right, the second 2 exercises, you don't really want to do in a doctor's office. You probably want to do these at home where you have a kind of a carpeted surface, things like that. You don't have to have a yoga mat. By the way, this is pregnant Rebecca, who's a wonderful yoga instructor who's letting me use her mat. And we once again want to thank Matt from the tap room for letting us use the yoga studio. But once again, this is a pretty commonly known stretch that you can do called the cat and the cow. You get on your all fours just like this, and you're going to breathe in and out. Now remember, you're going to go from the cat, like an arched back, mad Halloween cat, to the cow. Think of like a dairy cow with a big underbelly dangling down like that. So we're going to be going from that to that, okay? Shouldn't be any pain. It should feel just a little tight. Now, the breathing is key here. As you do the cow, you're going to breathe in. Think of a mad cat. They hiss. So you're breathing out as you become the cat. Ready? Like that, and then in as you go to the cow. Out and in. Just like that. You want to do about 10 of those, and you could do those 2 or 3 times a day when you're at the house and you feel some of that pain. Now, we're going to move on to the 3rd exercise. All right, the last one is one of my favorites. This one probably feels the best. Once again, you need to be in your house or somewhere like that. You don't need a wonderful yoga mat like this. You can do it on the carpet, even though pregnant Rebecca's an awesome yoga instructor, by the way, who helps me with these types of things. You don't need this. You just need a carpeted area where it doesn't hurt your knees, okay? Now, this one is called the pigeon, and it's another yoga move. And the way you're going to do this is you're going to kind of be on your hands and knees like this. You're going to bring one leg forward like this, just like this. We're going to bring that knee down, okay? Now, once we get comfortable like this, we're going to take the toe and we're going to move it back. You're not turning. You don't want to do this. You want to keep your hips straight, just like this. And if this is all you can do, that's fine. Just stay where that is. You should feel that tightness. The idea here is to open things up, let some blood flow in and out. One really cool thing about this, your baby is not in trouble with this. Let's say this is the baby, okay? Baby's here, no problem. I'm not laying on my stomach or anything like that. The baby's just hanging out, no compromised blood flow, nothing like that. toe, back a little more. Oh, that feels good. Now, I'm gonna switch other side, just like this. Knee comes forward, toe, back you go. Keeping my hips straight, just like that. And then just sit here. Read a magazine, something like that. Watch TV, it doesn't matter. You wanna stay here for maybe 3 or 4 minutes. Breathing in and out, let that hip open up. So, there's 3 exercises you can do that I hope will help with your lower back pain. I want to thank Neves Media for helping produce this video. Once again, this is not medical advice. These are just some exercises that you can do to hopefully help with your low back pain and pregnancy. Have a great day.